Presenting to you iTalk 2nd edition 2023, jointly organized by the Department of Commerce, MAHE-Manipal and IBAT. IBAT isn't just a typical think tank. It's a dynamic force that concludes extensive research and also engages in advocacy on subjects spanning the realms of management, both in general and its specific aspects like the social policy, economics, geopolitics, technology, and culture. This remarkable organization is dedicated to addressing the issues that have substantial importance and impact in our society today, both at home in India and also in the global arena. Allow me to introduce to you all the host, Department of Commerce, MAHE-Manipal. Department of Commerce is a dynamic hub of knowledge and expertise where academic rigor meets real-world applications. It also is leading in shaping future leaders of commerce and industry. Department of Commerce Manipal Academy of Higher Education has courses to offer in BBA, BCom, MSc, MCom, MA, and PhD in Logistics and Supply Chain Management. A brief about the Department of Commerce. This morning, we've gathered here to introduce to you iTalk, a project that springs from the very core of IBAT's predominant mission. iTalk is a community-driven effort aimed at bringing IBAT's enlightenment ideas to the hearts and minds of the local communities throughout India. It's about sharing impactful ideas, sparkling meaningful discussions, and also creating a wave of positive change. We hope that you find today's event as engaging, thought-provoking, and inspiring as it is always. As we explore the potential of iTalk, let us invite you all into this brightening and enlightening journey. We welcome you all.
The organizing committee this year has come up with a very diverse kind of setup of speakers, where we have speakers coming from different backgrounds who are going to enlighten their experiences, their learnings to all of you. And it is definitely going to be a very informative, entertaining, and something which will give you a chance to think about certain things which you may probably have never thought about. Many times in our routine life, we focus on our disciplines, what we have come to study for, and we ignore certain areas which probably would interest us and would definitely make us a better or holistic personality. But we typically ignore those topics, and we focus morely on the discipline. We start working in silos. So typically this particular kind of activity we are actually organizing to break this silo so that people work on interdisciplinary areas. And that is something which even the National Education Policy talks about, and even MAHE advocates it to a large extent. So keeping that in mind, Department of Commerce and IBAT partnered in organizing this activity. And we have this wonderful location where we are organizing it. I am sure you will enjoy the entire show.
In the interest of the upcoming students, they should know what is going on around. They should know which career they should select and all that. And for that purpose, they should have first-hand information from this HU's mouth. So it is not online program, it is offline program, 1:1, and therefore, if you listen to those people who are outside in their profession, who are outside in their activities and all that, and who have excelled in almost all the fields, and that's why we have selected the speakers from different fields. So we got professors, we got doctors, medicine, and education academicians, and all that.
I request Dr. Sandeep Shenoy, CA Rajaram Shetty, Dr. K. Dasharath to join us as well to do the honors. Thank you. I request all speakers, organizing committee members, and curators to come forward for a group photograph. All the speakers, organizing committee members, curators, kindly come forward for a group photograph.
Dr. Rachana Bhat. She is an alumnus of KMC-Manipal and has pursued her post-graduation in Emergency Medicine IMS, New Delhi. She is currently an assistant professor in the Department of Emergency Medicine at KMC-Manipal. She was the best outgoing lady medical graduate of her batch and was awarded the American College of Emergency Physicians Unconventional Global Leadership Award in 2020. She was a member of Indian Youth Delegation through the Ministry of Youth Affairs and Sports to the 19th World's Festival of Youth and Students held at Sochi, Russia, which was attended by around 20,000 delegates from over 180 countries. She was selected as one of the 12 speakers to the present discussions of President of Russian Federation, Mr. Vladimir Putin. She has been a part of Emergency Medical Human Resources Project for Disaster Medicine Training at Osaka, Japan, and also the recipient of Royal College of Emergency Physician Sponsorship Award for presentation at the Annual Scientific Conference in 2021. She is keenly interested in quality improvement and has worked with WHO Zero Project in capacity building program for trauma care system development for the state of Rajasthan. Dr. Rachana has keen interest in developing low-resource sustainable emergency care at various levels. She has previously worked at District Hospital Udupi and has established the Center for SAVE, Sustainable, Affordable, Value-Based Solutions in Emergency Care under MAHE. Dr. Rachana, please.
Thank you very much. Before proceeding further, what are the thoughts in the room regarding this question right now? How many of you feel true? Yes. Okay. I see, okay, few half hands and few full hands. I hope I can change that statistic by the end of next 8 minutes. Okay. So I would like to go back and start the story from my residency. I was fortunate to be one of the first few batches of emergency medicine at this Apex Institute. And the good part about that was we were trained not only in patient care, but also to understand about holistic healthcare system. So a lot of what I'm going to speak today is the result of the seeds of vision sown by my gurus there. So acknowledging their contribution, I proceed further. So AIIMS New Delhi is one of the busiest emergency departments in the country, where we get about 400 to 900 patients in emergency alone per day. So if you go by the actual definition of disaster, yeah, the resources are overwhelmed almost on a daily basis. So what happens is when you start working as a young doctor in this particular system, say by around 6 months to 1 year, you're in that ignorant phase, and then you start saving lives in spite of all challenges. There is a phase where you feel you know everything, you have seen it all, you know it all. And it was at that time when my, terminologies, which pushed me through the slope of that Dunning-Kruger curve, which you keep seeing these days. Oh, there is a lot more which I probably don't know. And these two beautiful terminologies, where one of it was quality improvement and second is ergonomics. And these two terminologies have had a very major impact on me, not just my professional life, but also a lot of my personal life as well. So just to give a brief introduction about what exactly these two terms are. So quality, we might be hearing quality multiple times in our university. We have NAC accreditation, NABH, XYZ, so many key performance indicators, metrics to be submitted. So that is not what quality improvement is. Okay, so quality improvement is that implementation sign, like quality assurance, what we speak about, tells us what needs to be done, and quality improvement is looking into it and actually getting it done. So it's that implementation science. Okay, and the key words here it is that it's self-driven, it's non-punitive, and the motivation is purely internal. And it all starts with a very humble thought of accepting that there are gaps, accepting that there are fallacies, and accepting that there is a scope for improvement. And then obviously there is a cycle of science which goes on where you identify, you analyze, then you test various ideas and then see what works, what doesn't work, etc. Ergonomics, obviously there are much more people who would know what this is over here. But just to introduce, ergonomics is work science where you try to design the environment to extract best efficiency from the person working there. So rather than the general tendency is like adjust karo and asking the person who's working there to get adjusted to the environment, you adjust the surroundings to actually extract the best efficiency from the employee who's working there. So again, a very beautiful term, and if you understand the depth of it, it's something which can help you in various fronts. So it is at this time, I realized that I was actually a very small minuscule in this entire healthcare universe or healthcare ecosystem. And there is a host of other things which actually has a major part in saving lives. So next is a series of stories where I would link to a lot of things or a lot of other branches which actually pitch in. We'll see how many we can cover in the given time frame. I think I'll need an alert 1 minute before I need to stop. Okay, so first story is what's causing delay in ECG. ECG is a test which we do for patients with chest pain to identify if there's a heart attack or not. So as per all the universal standards, the requirement is that when a patient with chest pain comes to the emergency department, the ECG needs to be done within 10 minutes. That is, door to ECG time should be at least 10 minutes. So we were all in this utopic world that no, ours is the best institute, it's happening all the time. But then came, okay, let's just actually measure and see whether it's happening or not. And we saw that the least time ECG was taking in our hospital was 12 minutes. That is the least time. And maximum time sometimes went to 25-30 minutes. And can anyone guess what was causing this delay? Any guesses? Okay, processes, but it was taking us at least 7 minutes to shift that patient from the door to our resuscitation area amidst those crowded corridors of that emergency department. So this is where I tell that healthcare architecture is one of the probably, it's good that it's improving these days, but if you go to most of the institutes, most of the established emergency departments, including some of the best corporate hospitals, healthcare architecture is not given heed to. So it's usually the buildings are built and things are just put in place. But architecture is something which can actually save a lot of time when we actually go to manage these patients. So yeah, if you're a good architect, you can contribute to saving lives. And for a patient with a major heart attack, probably every minute of these 7 minutes would mean life or death if there's a delay in intervention. So let's move on to the second story. So second story is, this was when I was working in Manipal. We had a 30-year-old patient who was brought after a history of fall from height, and he was being transferred from Kundapur. So when we examined him in our emergency department, he was not able to move any of his limbs, hands or legs. And when we probed further, he told just to some distance before coming to Manipal, he was able to move. And then he couldn't move. Okay, so those are the stories. A bad hump on the road or an ambulance vehicle suspension, which is bad. So what happens is when there is an injury to the backbone, all the nerves of our hands, legs, breathing muscles, everything go through that. And when there's a fracture, we tell the patients do not move or do not move the back. So even when we transfer, we have a board, we have a collar placed. So any injury there and there is a sudden jerky movement might mean that the patient is paralyzed for life. So in fact, when I was working with the WHO CRO on the Rajasthan project, one of the important part of our team for preventing trauma-related deaths was the road safety cell. The design of the road, where the signages are put, and all of this can have a major impact on how actually the outcome of an RTA could be. So again, this is the department of probably civil, mechanical. They can have a major impact on saving lives. Third story is a rather sad story. This happened when I came to Manipal and went back to AIIMS to work during the second wave of COVID. And in Delhi, this was quite horrendous. We would walk into our shifts with around 10 to 15 dead bodies lying in the corridor, waiting to get shifted. In terms of resources, everything was overwhelmed. We were less number of people, ventilators attached everywhere, oxygen ports were being split and used. So after a while, when things seem settled, suddenly you see that 7 to 8 patients suddenly they collapse suddenly, the ventilator stops working, and oxygen levels go down. So with whatever team we have, we go with our backup oxygen cylinders, try to somehow get control of the situation and save. And this happened probably twice or thrice. As our keynote speaker, Joshi sir, mentioned, initially we felt it's destiny of those patients. You work everything, the outcome is not there. Karm karo, phal ki ichha mat karo. But when we analyzed and went to the root cause of this problem, we realized that the problem was that the pressure in the oxygen lines were going down. Yes, I'll stop with this story and then we'll discuss few snippets about other things. So what was happening, this is probably, if I have to put it like a problem which you get in your entrance exam in 11th or 12th. So what is the minimum number of ventilators which you can attach in series without causing that critical drop in pressure in the oxygen lines? What happens when hospitals are constructed is, you have a ward constructed with oxygen lines everywhere, and most of the times all these ports are not in use. Or even if patients are put on oxygen over there, it is probably at 5 to 6 liters per minute of oxygen, and when you attach a ventilator in the same port, it draws at least 100 to 150 liters per minute. And then you have all these ports and suddenly a pandemic comes and you're using all the oxygen ports for ventilators. So this problem is, I think it's fluid dynamics, again, probably not medicine. And probably this understanding could have helped in saving lives. So I have more stories. Biomedical is something which we keep working with. Boot up time of USG machine can help in saving lives. So when we get an accident case, and one of the causes which can immediately cause death is fluid collection around the heart. So the only way which we can pick up in such condition is with an ultrasound. And this happens in terms of minutes. Imagine we have an ultrasound machine where the boot up time is 2 minutes. You don't have that opportunity at all. So it's not just that. Supply chain. You're on a shift at 3 a.m. There's an accident of a bus. 40 students walk in. You don't know how the supply chain is going to work. You are sorting out so many other things, including hospital registration, speaking to them. This actually happened. We had a school bus from Andhra going for a school trip, which had an accident near Kundapur, and all of them came here. None of the boys speak the local language here. So it's not just that. Probably coming up with low-cost, innovative solutions, finance, CSR. A lot of thought and passion might go into giving CSR products, to the hospital. But this was when I worked in the district hospital, I realized that they got a lot of high-flow oxygen devices which was not used, which was put there. But the same device in a different setup would mean gold. We could make much more use of it. So probably the initiative should come from the grassroots as to what exactly, where the fund should exactly go, where it's needed. WhatsApp has saved a lot of lives. A remote district in Himachal, they had a lot of problem with expertise. Since WhatsApp came, ECGs are being sent to an expert at tele center, and then it's interpreted and treatment is given there. For them to actually reach the hospital with whatever means available, it would take 6 to 8 hours. AI can reduce a lot of cognitive overload for doctors, probably reduce a lot of human errors, which is there. And obviously, like everyone speaks, we also are working on climate change, green need initiatives, etc. So these are few, I've already spoken about it. Since we have less time, we'll go. So the crux of this comes that whenever we speak about quality improvement, one of the important part of that process is change ideas or finding solutions. So when you actually find solutions, you can categorize them into 3 things: people, process, and systems. To take a small analogy, like if the problem is of traffic jam, so you can educate people to follow traffic rules, you can educate people to not just jet their vehicle amidst when it's crowded. So this is a people-related change. You know it's very cumbersome, you have to keep doing it. There are new crop of people who come in, new people need to be educated. So these are people. Sad part is most of our changes we go by people. We go training. Most of the times, educate, provide knowledge, training. And then there is something called process changes. Like for example, you introduce a traffic light system, but then there are still few people who may not follow or may try to jump the signal. And then there is a system-related change, where the scope for human errors are minimized to the ebb. So most of the system changes which happen in healthcare are not usually initiated by doctors. It's by all of these other things, which some things I spoke about. So when a doctor can probably contribute to saving 1 life at a time, probably all these other allied branches with a smart solution may contribute to saving multiple lives over a period of time. So next time you come to the hospital, you might see hundreds of problems. You might get irritated that there's a delay, you might not have place to sit, or your bed was uncomfortable. So rather than probably thinking of them as problems, see if you can probably contribute in terms of solutions. And if you want to connect and contribute, we are always happy to collaborate. This is the Center for SAFE, for Sustainable, Affordable, Value-Based Emergency Care Solutions. Thank you so much. Thank you, IBAT, for this opportunity.
Dr. Maxine and I were having this discussion before the program started about how important the Guru Shishya Parampara is. It's a bond that, takes humanity forward. And I'm having goosebumps as I'm telling this to you. It was so refreshing that you began your talk thanking your gurus. That very rarely it happens. Thank you so much. Thank you so much. And thank you for that informative talk that you just gave. And I have a master's in ergonomics. I'm just one small factor that I would like to give you. I will not waste too much time. You fix a man to the job, or you fix the job to the man. Think of that from that perspective also. Something to think about.